Explain how case managers can address social determinants of health (ESTO) to reduce healthcare disparities. What role do case managers play in improving access to care for marginalized populations? Answer: case managers play a vital role in addressing social determinants of health (ESTO), which encompass the conditions in which people are born, grow, live, work, and age. These determinants significantly impact health outcomes and contribute to healthcare disparities. By conducting comprehensive assessments that identify these social factors, such as income, education, employment, housing stability, and access to healthcare, case managers can develop tailored care plans that address the unique needs of marginalized populations. To reduce healthcare disparities, case managers collaborate with community organizations and resources that provide support in these areas. For instance, if a client faces housing instability, a case manager may refer them to local shelters or housing assistance programs. Additionally, by utilizing data on population health, case managers can prioritize interventions that target high-risk groups, ensuring that resources are allocated effectively. Advocacy is also a crucial component of their role. Case managers must work to empower clients, helping them navigate complex healthcare systems and access necessary services. This might involve assisting with applications for social services, providing transportation solutions, or connecting clients with educational programs that promote health literacy. Mr. Alvarez, a 52-year-old factory worker, has been recently diagnosed with type 2 diabetes. During your assessment, you discover that Mr. Alvarez is also struggling with housing insecurity, has no reliable transportation, and often misses medical appointments. What should be your first priority in his case management plan, and what steps should you take to ensure holistic care for Mr. Alvarez? Answer: in Mr. Alvarez's case, the first priority should be to address his housing insecurity and transportation issues, as these factors significantly affect his ability to manage his newly diagnosed type 2 diabetes. A stable living environment is essential for him to maintain a healthy lifestyle, adhere to treatment plans, and regularly attend medical appointments. To ensure holistic care, the first step is to conduct a thorough assessment of his housing situation. Referring Mr. Alvarez to local housing assistance programs or shelters can provide immediate relief. Once stable housing is secured, the next focus should be on transportation, connecting him with community resources that offer ride services for medical appointments, such as Medicaid's Non-Emergency Medical Transportation (NEM) program, is vital to ensure he receives consistent medical care. In addition to these immediate needs, developing a comprehensive diabetes management plan is crucial. This plan should include education about diabetes self-management, dietary modifications, and the importance of regular blood sugar monitoring. Utilizing telehealth services can be a solution if transportation continues to be a barrier. By employing a multifaceted approach that addresses both his medical condition and the social determinants impacting his health, case managers can support Mr. Alvarez in achieving better health outcomes. Describe the key components of motivational interviewing and explain how this technique can be applied in the case management of clients with chronic conditions such as hypertension. Answer: motivational interviewing is a person-centered counseling technique that aims to enhance intrinsic motivation for change by resolving ambivalence. Key components of MI include expressing empathy. Through active listening and validation of clients' feelings, case managers build a trusting relationship that encourages open dialogue about health behaviors. Developing discrepancy. This involves helping clients recognize the gap between their current behaviors and their personal health goals, fostering awareness of the need for change. Rolling with resistance. Instead of confronting resistance, case managers adapt to clients' responses, allowing them to explore their feelings and thoughts regarding change without feeling pressured. Supporting self-efficacy. Case managers emphasize client strengths and past successes, encouraging them to believe in their ability to make positive changes. When managing clients with chronic conditions like hypertension, MI can effectively promote lifestyle changes necessary for managing their health. For example, a case manager may use MI to help a client understand the importance of adhering to a low-sodium diet and regular exercise. By guiding the conversation towards the client's own motivations for health, such as wanting to reduce medication or improve energy levels, case managers can empower clients to take ownership of their health and enhance their adherence to treatment plans. Overall, MI fosters a collaborative environment where clients feel supported in their journey towards better health. How do case managers integrate public health principles in individual case management, particularly during public health emergencies such as a pandemic? Answer: case managers integrate public health principles into individual case management by focusing on health promotion, disease prevention, and population health management, especially during public health emergencies like pandemics. This integration requires a proactive approach to identifying and addressing health risks within the community. During a pandemic, case managers should prioritize risk assessment and health education. They are responsible for disseminating accurate information regarding preventive measures such as vaccination, hand hygiene, and social distancing, ensuring that clients understand their role in preventing disease spread. This also involves continuous monitoring of community health trends and emerging public health guidelines from authorities like the Centers for Disease Control and Prevention (CDC). Additionally, case managers coordinate care across multiple settings, ensuring that clients have access to essential health services. This might include connecting clients to telehealth resources for non-emergency medical consultations, as well as facilitating access to mental health services for those experiencing increased anxiety or stress due to the pandemic. MS. Bennett, a 78-year-old widow, is living alone and has limited mobility. She has recently been diagnosed with congestive heart failure and is also showing signs of depression. Her children live out of state, and she has no nearby support system. What steps should you take as a case manager to address her physical and mental health needs? Answer. In managing MS, Bennett's case, a comprehensive approach is essential due to her physical and mental health challenges. The first step is to assess her immediate physical needs related to her congestive heart failure. This involves coordinating with healthcare providers to arrange home health services where nurses or aides can assist her with daily living activities and monitor her health status. Addressing her mental health is equally important, especially considering the signs of depression. Referring her to a mental health professional for evaluation and therapy can help her cope with her situation. Community resources, such as senior centers or online support groups, can also provide social engagement opportunities, reducing feelings of isolation. Additionally, implementing a care plan that includes nutritional guidance, medication management, and regular follow-up appointments is crucial for her heart condition. Providing educational resources about congestive heart failure management will empower MS. Bennett to take an active role in her health. Since MS, Bennett's children live out of state, involving them in her care plan through regular communication and updates can help maintain family connections and support. What are the challenges in maintaining confidentiality in case management, especially when working with multidisciplinary teams, and how can these challenges be addressed in compliance with the Health Insurance Portability and Accountability Act (HIPAA)? Answer. Maintaining confidentiality in case management, particularly within multidisciplinary teams, presents several challenges, such as the potential for unauthorized access to sensitive client information and miscommunication during team meetings. When multiple professionals share information about a client's care, the risk of breaches increases, especially if not all team members are aware of confidentiality protocols. To address these challenges, case managers must implement strict access controls, ensuring that only authorized personnel can access client records based on their roles. This may involve utilizing secure electronic health record (EHR) systems that track who accesses client information and when. Secure communication channels should also be established for discussing client information, such as encrypted emails or secure messaging apps. In meetings, case managers should emphasize the importance of confidentiality and remind team members not to discuss client details outside of professional settings. Furthermore, obtaining informed consent from clients before sharing their information is crucial. This ensures clients are aware of who their information will be shared with and for what purposes. Discuss the importance of cultural competency in case management and how it impacts client outcomes. Provide examples of strategies to improve cultural competency in practice. Answer. Cultural competency is vital in case management because it enables providers to effectively meet the diverse needs of clients from various cultural backgrounds. Understanding clients' cultural beliefs, values, and practices can significantly impact client engagement, treatment adherence, and overall health outcomes. When case managers demonstrate cultural competence, they build trust and rapport with clients, leading to better communication and improved health behaviors. To enhance cultural competency, case managers can employ several strategies. One effective approach is conducting comprehensive cultural assessments during the intake process to gather information about clients' backgrounds, beliefs, and preferences. This data can guide care planning and interventions tailored to each client's unique needs. Another strategy involves providing training for case managers on cultural awareness and sensitivity. This education can include topics such as understanding cultural variations in health beliefs and practices, as well as addressing implicit biases that may affect client interactions. Engaging with community leaders and organizations representing diverse populations can also enhance cultural competency. Case managers can collaborate with these groups to identify culturally appropriate resources and services, ensuring that clients feel understood and supported. Additionally, utilizing interpreters or translation services when language barriers exist is crucial for effective communication. By implementing these strategies, case managers can improve client satisfaction, enhance adherence to treatment plans, and ultimately achieve better health outcomes for diverse populations. Evaluate the role of technology in enhancing case management processes. What are some examples of tools and platforms that can facilitate communication, coordination, and documentation in case management? Answer: technology plays a transformative role in enhancing case management processes by improving communication, coordination, and documentation. Various tools and platforms facilitate these functions, enabling case managers to provide more efficient and effective care. One key technology is the use of electronic health records (EHRs), which streamline documentation and enable case managers to easily access client information, treatment histories, and progress notes. HRS enhance care coordination by allowing multiple providers to share information in real time, reducing the likelihood of errors and duplications. Telehealth platforms are also significant, especially in expanding access to care. These platforms allow case managers to conduct virtual visits, which can be particularly beneficial for clients with mobility issues or those living in rural areas. Through telehealth, case managers can monitor clients' health status, provide education, and facilitate follow-up care without the need for in-person visits. Communication tools such as secure messaging apps enable case managers to maintain ongoing contact with clients and interdisciplinary team members. These tools ensure that critical information is shared promptly, fostering collaboration and timely interventions. Data analytics platforms can further enhance case management by identifying trends and patterns in client data, allowing case managers to tailor interventions based on population health needs. Overall, leveraging technology not only streamlines case management processes, but also improves client outcomes through enhanced access to care and more coordinated services. Mr. Singh is a 34-year-old man with a history of substance abuse. He is currently in recovery, but faces challenges such as unemployment, lack of stable housing, and stigma related to his past. What interventions would you recommend to support Mr. Singh's recovery while addressing these challenges? Answer: supporting Mr. Singh in his recovery involves a multifaceted approach that addresses his substance abuse history and the challenges of unemployment, unstable housing, and stigma. First, connecting Mr. Singh with substance abuse support services is crucial. This can include outpatient rehabilitation programs and support groups such as Narcotics Anonymous, where he can engage with peers who understand his challenges and provide mutual support. Addressing his housing insecurity is also a priority. Case managers should assist Mr. Singh in applying for housing assistance programs such as transitional housing or sober living facilities, which offer structured environments conducive to recovery. Employment resources are vital for his recovery and self-sufficiency. Referring Mr. Singh to job training programs that specialize in helping individuals with a history of substance abuse can enhance his employability. Resume workshops and job placement services can also facilitate his transition into the workforce. Advocacy for healthcare access is essential. Case managers should work with healthcare providers to ensure Mr. Singh receives non-discriminatory treatment, emphasizing the importance of treating individuals with dignity, regardless of their past. Finally, developing a personalized relapse prevention plan with Mr. Singh can empower him to identify triggers and implement coping strategies. By combining these interventions, case managers can support Mr. Singh's recovery journey while helping him navigate the complexities of his situation. Analyze the impact of community resources and social support networks on case management outcomes. How can case managers effectively leverage these resources to enhance client care? Community resources and social support networks play a significant role in influencing case management outcomes. Access to these resources can lead to improved health outcomes, greater adherence to treatment plans, and enhanced quality of life for clients. When case managers effectively leverage community resources, they create a supportive environment that addresses clients' holistic needs. One way to integrate these resources is through resource mapping, where case managers compile a comprehensive list of available local services, such as food banks, transportation options, mental health services, and financial assistance programs. This mapping allows case managers to connect clients with the resources most relevant to their needs. Building partnerships with community organizations enhances collaboration and facilitates referrals. For example, if the client requires mental health support, case managers can establish relationships with local mental health agencies, ensuring that clients receive the necessary services promptly. Empowering clients is another critical strategy. Educating clients about available resources fosters self-management and independence, encouraging them to take an active role in their care. Additionally, implementing feedback mechanisms to gather client insights on the effectiveness of community resources can help case managers refine their approach and improve service delivery. Research indicates that clients actively engaged with community resources experience better health outcomes, underscoring the importance of integrating these supports into case management practices. Overall, leveraging community resources and social networks can significantly enhance client care and promote positive outcomes. Which utilization review process is the most critical for preventing unnecessary hospital admissions and ensuring the appropriate use of healthcare services? Answer: the prospective utilization review is pivotal for preventing unnecessary hospital admissions. This process evaluates the necessity and appropriateness of proposed medical services before they are provided, which can lead to significant cost savings for healthcare systems and improved patient outcomes. The focus here is to ensure that the recommended interventions meet established criteria for medical necessity. For instance, a patient scheduled for surgery would be assessed to determine if less invasive or non-surgical options are available and suitable. This aspect of utilization review directly aligns with the objectives outlined by the Centers for Medicare and Medicaid Services (CMS), which emphasizes the necessity for healthcare providers to demonstrate that treatments meet criteria for medical necessity. Guidelines such as minimum care guidelines or Intercal criteria serve as benchmarks in this evaluation. Prospective reviews can help identify patients at risk of complications or those who may benefit from alternative care settings, thus decreasing hospital admissions. Furthermore, this proactive approach enables case managers to advocate for preventive care measures and resources, thereby fostering a more efficient allocation of healthcare resources while enhancing overall patient safety. MS Turner, a 68-year-old patient with diabetes, has been hospitalized multiple times within the last year due to uncontrolled blood sugar levels. As the case manager, what steps should you take to reduce the likelihood of readmission and overall healthcare costs? Answer: to effectively manage MS Turner's complex case and reduce the risk of readmission, the case manager should initiate a comprehensive care plan that incorporates multiple strategies. First, it's crucial to develop a personalized discharge plan that includes home health support and frequent follow-up care. A transition to home health services can ensure she receives regular monitoring and assistance with daily activities, particularly regarding her diabetes management. Second, conducting a thorough medication reconciliation is essential. This step ensures that MS Turner fully understands her medication regimen, which may include insulin therapy and oral hypoglycemics. Education sessions that emphasize adherence to the prescribed treatment can help mitigate the risk of future complications. Additionally, assessing her social determinants of health is vital. Identifying barriers such as transportation issues or financial constraints can enable the case manager to connect her with community resources or support programs that offer assistance. Referring her to diabetes education programs can empower her with the knowledge necessary for better self-management of her condition. How should a case manager determine whether a patient requires acute care or skilled nursing facility care upon discharge? Answer: determining the appropriate level of care upon discharge involves a comprehensive assessment of the patient's clinical condition, functional status, and ongoing care needs. The case manager must evaluate whether the patient's health situation requires intensive medical intervention, which would necessitate acute care, typically provided in a hospital setting. This includes conditions requiring continuous monitoring or specialized medical treatments, such as severe infections, post-operative care, or life-threatening illnesses. Conversely, if the patient exhibits stability but still requires skilled nursing or rehabilitation services, such as daily wound care, physical therapy, or medication management, skilled nursing facility (SNF) care would be appropriate. The assessment should include the patient's ability to perform activities of daily living adults and their overall prognosis. Tools like the Functional Independence Measure (FIM) can aid in this evaluation. In this process, established guidelines play a crucial role. The Centers for Medicare and Medicaid Services (CMS) outlines specific criteria for admission to skilled nursing facilities, emphasizing the need for skilled services that cannot be provided at home or through outpatient therapy. Why is medication reconciliation a critical component of discharge planning, and what are the potential consequences of failing to complete this process effectively? Answer: medication reconciliation is an essential component of discharge planning that ensures continuity of care and minimizes the risk of medication errors. It involves comparing the patient's medication orders to all of the medications the patient has been taking to identify any discrepancies, including omissions, duplications, or interactions. This process is especially critical for patients transitioning from hospital to home, where they may experience changes in their medication regimens due to their treatment during hospitalization. Failing to perform thorough medication reconciliation can have severe consequences, such as adverse drug events, ADES, which are a leading cause of hospital readmissions. For instance, if a patient is discharged with a new medication but is not informed about potential interactions with their existing medications, it could lead to serious health complications or ineffective treatment. The Joint Commission emphasizes that effective medication reconciliation must occur at every transition of care to safeguard patient safety by ensuring that patients understand their medication regimens and have clear instructions on how to take them. Case managers can help reduce readmission rates and improve overall health outcomes. List 3 common barriers to safe discharge and explain how a case manager can address them. Answer: several barriers can impede safe discharge, and addressing these effectively is vital for ensuring a smooth transition from hospital to home. 3 common barriers include lack of family or caregiver support. Patients may lack adequate support systems for managing their care at home. To address this, the case manager can assess the patient's social situation and coordinate with family members or caregivers, providing education on how to assist the patient effectively. Additionally, involving social services can help arrange for home health services or respite care to ensure the patient receives the necessary assistance post-discharge. Financial limitations. Many patients face financial barriers that can hinder access to medications, follow-up appointments, or required home health services. The case manager can assist by exploring community resources or financial assistance programs that may help cover these costs. Establishing a plan for affordable medication options, such as generic alternatives or patient assistance programs, is also crucial. Patient non-adherence to treatment plans. Non-adherence often stems from a lack of understanding or complexities in medication regimens. The case manager can address this by simplifying medication schedules, utilizing pill organizers, and providing comprehensive education about the importance of adherence. Regular follow-ups can also reinforce the treatment plan and address any issues that arise during recovery. By identifying and tackling these barriers, case managers can facilitate safer discharges and ultimately improve patient outcomes and satisfaction. Mr. Williams, a 55-year-old with congestive heart failure (CHF), is being discharged after a 10-day hospital stay. He has a history of non-adherence to medical appointments and poor self-management of his diet. What actions should the case manager take to ensure successful care coordination and prevent remission? Answer: to ensure Mr. Williams receives effective care coordination post-discharge and to minimize the risk of remission, the case manager should implement a multifaceted strategy focused on education, support, and monitoring. First, it is essential to establish a post-discharge follow-up plan that includes an appointment with his primary care provider within 48 hours of discharge. This early follow-up can catch any issues before they escalate, addressing his health status proactively. Second, the case manager should arrange home health services to provide ongoing monitoring of Mr. Williams's vital signs, such as blood pressure and weight, which are critical for patients with CHF. This oversight can help detect early signs of fluid overload or other complications. Education on managing his condition is paramount. The case manager should provide tailored sessions to teach Mr. Williams about the importance of a heart-healthy diet, low sodium intake, and adherence to prescribed medications. Involving a dietitian can offer personalized dietary guidance and encourage better food choices. Additionally, integrating telemedicine services can provide Mr. Williams with accessible medical support, allowing him to communicate with healthcare providers without the stress of traveling. Regular check-ins through telehealth can reinforce adherence to his treatment plan and facilitate timely adjustments. By employing these strategies, the case manager can create a supportive environment that enhances Mr. Williams's ability to manage his condition effectively, reducing the likelihood of remission. What is the role of authorization and pre-certification in managing healthcare resources, and how do they affect patient care? Answer: authorization and pre-certification are critical processes in healthcare management that help control costs and ensure the appropriate use of medical services. Authorization involves obtaining approval from an insurance provider before a patient receives certain services or procedures, while pre-certification is a more specific subset that often applies to hospital admissions and certain treatments. The role of these processes is to evaluate the medical necessity of the proposed treatment based on established guidelines and criteria, such as those set by CMS. By requiring prior authorization, healthcare payers can manage and prevent overutilization of services, ensuring that patients receive evidence-based care that aligns with their medical needs. While these processes can effectively manage healthcare resources and costs, they can also impact patient care significantly. Delays in obtaining authorization may postpone necessary treatments, potentially leading to worsened health conditions. This can particularly affect patients with acute or severe health issues where timely intervention is crucial. To mitigate these risks, case managers must proactively manage the authorization process by ensuring all necessary documentation is complete and submitted promptly. They should also communicate clearly with patients about the necessity of these processes and what to expect. Describe how a case manager can facilitate continuity of care during transitions between different levels of healthcare services. Answer: facilitating continuity of care during transitions is a crucial aspect of a case manager's role, particularly as patients move between various levels of healthcare services, such as from inpatient to outpatient settings or from hospital to home health. Effective transition management can significantly reduce the risk of readmissions and improve patient outcomes. First, the case manager should ensure comprehensive discharge planning that begins upon admission. This includes conducting assessments to identify the patient's ongoing care needs, preferences, and available support systems. As part of this process, the case manager can create a detailed discharge summary that outlines the patient's medical history, medications, and follow-up appointments. Secondly, establishing a communication plan among all parties involved in the patient's care is essential. This can involve directly connecting the patient's outpatient provider with the hospital team to ensure seamless communication about the patient's condition and treatment plan. Case managers should also encourage patients to engage in their care by providing them with educational resources and clear instructions on what to expect after discharge. Third, arranging for home health services or outpatient follow-up visits can help bridge the gap in care. These services provide necessary support and monitoring, enabling the patient to recover in a familiar environment while receiving professional oversight. Finally, utilizing tools like care transition protocols or patient activation measures (PAM) can further enhance the effectiveness of the transition process. By equipping patients with the knowledge and resources they need, case managers can empower them to take an active role in their care, fostering a smoother transition and ensuring continuity of services. Explain the importance of care coordination in complex cases and identify strategies a case manager can use to enhance this coordination. Answer: care coordination is crucial in managing complex cases where patients often have multiple comorbidities, requiring various healthcare providers and services. The importance of care coordination lies in its ability to streamline communication, enhance collaboration among healthcare professionals, and ultimately improve patient outcomes. In complex cases, patients may encounter fragmented care, leading to confusion, medication errors, and increased risk of complications. Effective care coordination ensures that all team members, including physicians, nurses, social workers, and specialists, work collaboratively toward a common goal of optimizing patient care. Strategies a case manager can implement to enhance care coordination include establishing a multidisciplinary team. Forming a team that includes all relevant providers can facilitate communication and ensure a comprehensive approach to patient care. Regular team meetings can be scheduled to discuss the patient's progress and adjust the care plan as necessary. Creating individualized care plans. Tailoring care plans to meet the specific needs of the patient helps to ensure that all providers are aligned on treatment goals. This plan should be easily accessible to all team members and regularly updated. Utilizing technology. Implementing electronic health records, and care coordination platforms can enhance information sharing and real-time updates among providers. This technology enables better tracking of the patient's progress and facilitates timely interventions. Patient and family engagement. Actively involving patients and their families in care decisions fosters a sense of ownership over their health. Educating them about their conditions and treatment options can lead to better adherence to care plans and improved outcomes. By employing these strategies, case managers can enhance care coordination, reduce the risk of adverse events, and ensure that patients receive the most effective and efficient care possible. Discuss the concept of length of stay, loss in healthcare, and its implications for case management. Answer: length of stay loss is a key performance indicator in healthcare that measures the duration of a patient's hospitalization from admission to discharge. It has significant implications for both patient care and healthcare system efficiency. In the context of case management, LOS is crucial for assessing the effectiveness of discharge planning and care coordination strategies. A shorter LOS is often associated with better resource utilization and cost effectiveness. However, it must be balanced with the quality of care. Case managers play a vital role in managing LOS by ensuring that patients are discharged only when it is safe and appropriate, while also preventing unnecessary delays that could prolong hospitalization without clinical justification. Several factors can influence LOS, including the complexity of the patient's medical condition, the efficiency of the discharge planning process, and the availability of post-acute care services. For instance, a well-coordinated discharge plan that includes timely follow-up appointments and adequate home health support can help reduce LOS while ensuring continuity of care. To effectively manage LOS, case managers should regularly evaluate patients' clinical statuses and discharge readiness. Tools such as critical pathways and length of stay protocols can assist in standardizing care processes and identifying opportunities for improving discharge efficiency. Moreover, addressing social determinants of health that could affect post-discharge recovery is essential for minimizing complications that may lead to remissions. By focusing on optimizing LOS while maintaining high-quality patient care, case managers can significantly impact healthcare delivery, enhancing outcomes for patients and the efficiency of healthcare systems. How can case managers utilize evidence-based practices in developing care plans for patients with chronic illnesses? Answer: case managers can utilize evidence-based practices in the following ways. Research and guidelines. Stay updated on the latest research, clinical guidelines, and best practices relevant to specific chronic illnesses. This includes reviewing systematic reviews, clinical practice guidelines, and recommendations from reputable health organizations. Patient assessment. Use standardized assessment tools and screening methods validated by research to evaluate the severity of the patient's condition and to identify their specific needs. Individualized care plans. Develop care plans based on the best available evidence tailored to the patient's unique circumstances, preferences, and values. This may involve integrating interventions that have been shown to improve outcomes for patients with similar conditions. Outcome measurement. Implement processes for measuring patient outcomes to assess the effectiveness of interventions. Regularly review and adjust care plans based on patient progress and emerging evidence. Collaboration. Engage in interdisciplinary collaboration with healthcare professionals who also employ evidence-based practices in their respective fields. This enhances the holistic management of the patient's chronic illness. Patient education. Provide patients with educational resources based on evidence, such as self-management strategies and lifestyle modifications that have been proven to be effective in managing chronic conditions. By utilizing evidence-based practices, case managers can enhance the quality of care provided to patients, improve health outcomes, and ensure that interventions are grounded in the most current and relevant research. What strategies can case managers implement to effectively advocate for patients who face barriers to accessing healthcare services? Answer: case managers can implement several strategies to advocate for patients facing barriers to accessing healthcare services. Needs assessment. Conduct a thorough assessment to identify specific barriers the patient faces, such as financial constraints, lack of transportation, language barriers, or inadequate health literacy. Resource connection. Connect patients to community resources, such as financial assistance programs, transportation services, or language interpretation services to address identified barriers. Health education. Provide education and information that empowers patients to understand their health conditions, treatment options, and available resources. This can enhance health literacy and enable patients to navigate the healthcare system more effectively. Collaboration with providers. Work collaboratively with healthcare providers to ensure they are aware of the patient's barriers and advocate for accommodations, e.g., extended hours, telehealth options that may assist the patient in receiving care. Policy advocacy. Engage in broader advocacy efforts to address systemic issues that create barriers to healthcare access, such as advocating for policy changes that improve insurance coverage or expand access to services for underserved populations. Follow-up. Implement regular follow-ups to ensure patients are successfully accessing services and to provide additional support as needed. Effective advocacy requires a proactive and collaborative approach, ensuring that patients receive the care they need while addressing barriers that impede their access to healthcare services. Describe the key components of a successful interdisciplinary team in case management. Answer: an effective interdisciplinary team is fundamental to successful case management, particularly in complex cases that require input from multiple healthcare professionals. The key components include diverse expertise. A successful interdisciplinary team should comprise professionals from various disciplines such as nursing, social work, psychology, and occupational therapy. This diversity allows for a holistic approach to client care, addressing multiple dimensions of health and well-being. Clear roles and responsibilities. Clearly defined roles within the team help ensure that each member understands their specific contributions to the case management process. Establishing accountability fosters collaboration and minimizes the risk of duplication of efforts. Open communication. Effective communication is crucial for an interdisciplinary team. Regular meetings, case conferences, and shared documentation systems can facilitate information exchange and promote a unified approach to client care. Utilizing technologies such as electronic health records (EHR) can enhance communication efficiency. Collaborative decision-making. Involving all team members in the decision-making process promotes a sense of ownership and encourages diverse perspectives. Joint decision-making fosters innovative solutions and enhances the quality of care provided to clients. Shared goals. Establishing common goals aligned with the client's needs ensures that the team works cohesively toward achieving desired outcomes. Regularly reviewing and adjusting these goals based on client progress and feedback is essential for maintaining focus and accountability. Conflict resolution mechanisms. Disagreements may arise within the team due to differing opinions or perspectives. Having established protocols for conflict resolution can help address issues promptly and maintain a positive working environment. The American Academy of Nursing supports interdisciplinary collaboration in case management, emphasizing the coordinated team approach enhances client outcomes by leveraging the strengths and expertise of diverse professionals. By fostering these components, interdisciplinary teams can effectively navigate complex cases and deliver comprehensive care. How should a case manager approach goal setting with clients who have complex psychosocial needs? Answer: goal setting with clients who have complex psychosocial needs is a critical component of effective case management, requiring a thoughtful and client-centered approach. The following strategies should be considered. Holistic assessment. Begin with a comprehensive assessment that explores not only the client's medical needs but also their psychosocial factors, including family dynamics, social support systems, financial stability, and housing status. Tools like the biopsychosocial model can guide this assessment. Client involvement. Engage clients actively in the goal-setting process to ensure that their preferences, values, and aspirations are central to the intervention. This collaboration fosters a sense of ownership and increases the likelihood of achieving the established goals. SMART goals. Utilize the SMART criteria: specific, measurable, achievable, relevant, time-bound to formulate clear and actionable goals. For example, instead of a vague goal such as to improve mental health, a SMART goal might state: attend weekly therapy sessions for the next 3 months to develop coping strategies. Prioritization. Given the complexity of psychosocial needs, it is essential to prioritize goals based on urgency and impact. Start with immediate needs that, when addressed, will facilitate progress toward broader goals, such as securing stable housing or enhancing social connections. Flexibility and adaptability. Recognize that psychosocial factors can be fluid and may change over time. Regularly revisit and adjust goals based on the client's evolving circumstances and feedback, ensuring that the intervention remains relevant and effective. Support systems. Identify and leverage the client support systems to help achieve their goals. Engaging family members, community resources, or peer support groups can provide additional motivation and assistance throughout the process. The National Association of Social Workers, NASWA, emphasizes the importance of a strengths-based approach in goal setting, which focuses on the client's resources and capacities to promote resilience and empowerment. By employing these strategies, case managers can develop meaningful and achievable goals that address the complex psychosocial needs of their clients. What are the ethical considerations a case manager must address when dealing with clients experiencing mental health crises? Answer: navigating ethical considerations when dealing with clients in mental health crises is paramount for case managers. Key ethical considerations include informed consent. Obtaining informed consent is fundamental when implementing interventions, even during crises. Clients should be informed about their treatment options, potential risks, and benefits, empowering them to make choices regarding their care. Confidentiality. Maintaining client confidentiality is crucial, particularly in mental health settings. However, case managers must also be aware of the limits of confidentiality, especially when there is a risk of harm to the client or others, adhering to the Health Insurance Portability and Accountability Act, HIPAA regulations, and discussing the parameters of confidentiality with clients is essential. Duty to warn and protect. If a client poses a danger to themselves or others, the case manager may have a legal and ethical obligation to take action to prevent harm. This may involve contacting emergency services or referring the client to a mental health professional for immediate assessment. The Tarasov ruling emphasizes the duty to protect individuals who may be at risk of harm from a client. Cultural sensitivity. Ethical practice requires case managers to be culturally sensitive and aware of how cultural factors influence a client's perception of mental health crises. Understanding the client's cultural context can inform appropriate interventions and ensure respectful care. Autonomy versus beneficence. Balancing client autonomy with the principle of beneficence, doing good, can be challenging in crisis situations. While it is important to respect a client's right to make decisions, case managers must also prioritize the client's safety and well-being. Engaging clients in discussions about their care options, even during crises, can help uphold their autonomy while ensuring appropriate support. The American Psychological Association (APA) emphasizes the importance of ethical practice in mental health settings, advocating for approaches that prioritize the dignity and welfare of clients. By addressing these ethical considerations, case managers can provide effective and compassionate support to clients experiencing mental health crises. MS. Smith, a 60-year-old woman with multiple chronic conditions, is being treated by several specialists, including a cardiologist, endocrinologist, and mental health provider. As her case manager, you notice a lack of communication between her providers, which is affecting her care. What steps should you take to improve coordination of care among MS Smith's healthcare providers? Answer: to improve coordination of care among MS Smith's healthcare providers, the case manager should take the following steps. Establish a communication network. Create a communication plan that facilitates information sharing among MS Smith's providers. This could involve setting up regular interdisciplinary team meetings or utilizing a shared electronic health record (EHR) system where all providers can access and update MS Smith's medical information. Schedule a care conference. Organize a care conference with MS Smith and her healthcare team to discuss her treatment plan, medication management, and any concerns. This meeting can help clarify roles and responsibilities among providers and foster a team approach to her care. Designate a primary provider. Encourage the identification of a primary provider who can act as the central point of contact for MS Smith's care. This provider can help oversee her treatment plan and ensure that all specialists are aligned with the goals of her care. Create a comprehensive care plan. Develop a comprehensive care plan that includes input from all providers and addresses MS Smith's chronic conditions holistically. Ensure that it is easily accessible to all involved in her care. Educate the patient. Provide MS Smith with information about her conditions and treatment options, and encourage her to communicate her experiences and concerns with all her providers. Empowering her to be an active participant in her care can improve coordination. By taking these steps, the case manager can enhance communication among providers, ensuring that MS Smith receives integrated and effective care across her various health needs. MS Lina Chen is a case manager working with a patient, Mr. Smith, who has chronic pain and has been prescribed opioids. Mr. Smith expresses concern about his potential dependency on pain medication. What steps should MS Chen take to address Mr. Smith's concerns while adhering to best practices in pain management and regulatory compliance? Answer: in this scenario, MS Chen should take the following steps. Assess the situation. Conduct a thorough assessment of Mr. Smith's pain management needs, including his medical history, current medications, and any previous substance use issues. Educate on pain management options. Inform Mr. Smith about alternative pain management strategies, including physical therapy, cognitive behavioral therapy, and non-opioid medications. Providing a comprehensive overview of his options can empower him to make informed decisions. Implement a multimodal approach. Develop a pain management plan that incorporates multiple modalities, including pharmacological and non-pharmacological interventions to reduce reliance on opioids. Establish a monitoring plan. Set up a regular follow-up schedule to monitor Mr. Smith's pain levels, functionality, and any signs of dependency. This includes utilizing prescription drug monitoring program (EDMPS) to track opioid prescriptions and usage, and encourage open communication. foster a supportive environment where Mr. Smith feels comfortable discussing his concerns and any side effects he may experience, ensuring that he feels involved in his care plan. What is the role of evidence-based practice in improving healthcare outcomes in case management, and how can case managers effectively implement BP in their daily work? Answer: evidence-based practice is a critical approach in case management that integrates the best available research evidence, clinical expertise, and patient values to guide decision-making in patient care. The role of BP in improving healthcare outcomes includes improved patient outcomes. BP ensures that interventions are scientifically validated, leading to better health outcomes and increased patient satisfaction. Standardization of care. Utilizing BP helps establish consistent protocols and guidelines, reducing variability in care delivery and enhancing overall quality. Cost effectiveness. Implementing BP can lead to more efficient use of resources as it promotes practices that are proven to be effective and avoids ineffective treatments. To effectively implement BP in daily work, case managers can stay informed, regularly review current literature, clinical guidelines, and research findings related to their patient population and clinical practice, engage in continuous education, participate in training programs and workshops focused on BP principles and methodologies, collaborate with interdisciplinary teams, work closely with healthcare providers from various disciplines to share insights and implement BP across care settings. Ms. Johnson, a case manager, notices that a patient with diabetes has been consistently non-compliant with their treatment plan, which includes medication and dietary changes. Upon further investigation, Ms. Johnson discovers that the patient is facing financial difficulties that prevent them from affording their medications. What steps should Ms. Johnson take to address this issue? Answer: Ms. Johnson should take a multifaceted approach to support her patient effectively, assess financial resources, conduct a thorough assessment of the patient's financial situation to identify specific barriers to care, such as medication costs, transportation issues, or access to healthy food, provide information on assistance programs, help the patient identify and access programs that offer financial assistance for medications, e.g., pharmaceutical company patient assistance programs, local charities, or government aid, explore alternative medications, discuss with the healthcare provider the possibility of prescribing more affordable medications or generics that the patient can afford, facilitate community resources, connect the patient with local food banks or nutrition programs that offer healthy food options at reduced costs, set achievable goals, collaborate with the patient to set small, achievable health goals that take into account their current resources and limitations. By addressing the financial barriers, Ms. Johnson can improve the patient's compliance and overall health outcomes. Discuss the importance of data security, confidentiality, and compliance in case management, particularly in relation to Health Insurance Portability and Accountability Act (HIPAA) regulations. Answer: data security, confidentiality, and compliance are critical components of effective case management, particularly under HIPAA regulations. The importance includes protection of patient information, ensuring that sensitive health data is safeguarded from unauthorized access. Breaches or leaks is essential for maintaining patient trust and confidentiality. Legal compliance. Case managers must adhere to HIPAA regulations, which mandate strict guidelines on how patient information is collected, stored, and shared. Non-compliance can result in substantial fines and legal penalties. Quality of care. Maintaining confidentiality enhances the therapeutic relationship between case managers and patients, fostering open communication about health issues without fear of judgment or exposure. To comply with HIPAA, case managers should implement training programs, regularly educate staff on data security practices, potential threats, and the importance of maintaining patient confidentiality, utilize secure systems, use encrypted communication tools and secure electronic health records to protect patient information.